you all for joining us this evening. I am Lynn Kintz, the Executive Director of the Bleeding Disorders Council of California, and welcoming you to our webinar, Speaking Up. This is going to be all about preparing for Legislative Day, and we're excited to have many of our future leaders coming this year. I think we have 23 future leaders that will be joining us on Saturday, and then others that will be joining us for Legislative Day on Monday. So we'll have a great group for that. So getting started here, for those that would like to use interpretation, the instructions are on your screen and also in the chat for being able to utilize the interpretation feature. It's also in your meeting controls if you're using an iOS or an Android device, an iPhone or an Android device. And again, you can follow the instructions in the chat as well. So just a few housekeeping items. There will be some opportunity for interaction, but if you are not specifically participating as a speaker, then we would ask you to use the chat and stay on mute during that time. And we also want to remind everyone that we are not providing medical advice or legal counsel, and also that we are recording the presentation. So it will be recorded and it will be made available to those who couldn't join us today and potentially posted down the road on our YouTube channel as well. So with that, I'm going to go ahead and jump in here. For those that are newer to the Bleeding Disorders Council of California, we were officially legally formed back in 1985, around that time, and we coordinate the shared advocacy agenda of the now 5 California Bleeding Disorders organizations. We focus on access to healthcare, education around healthcare and health insurance, and advocacy on behalf of individuals living with bleeding disorders and rare diseases. And so we're happy that you're going to be joining us and participating in some of these advocacy efforts that we have ongoing. So I'm going to be assuming that most of you who are joining us tonight are participating because you will be joining us on Legislative Day. Maybe you're a parent of one of our future leaders and you're just curious what they're going to be talking about. Perhaps there may also be a few of you that are not able to join us on Legislative Day. But I want you to stick with us because this is really great information, even if you're not going to be able to join us. And at the end, we are going to talk a little bit about ways that you can participate virtually in the same advocacy efforts that we're going to be doing on Monday at the state capitol. So, to kick things off, I want to jump in and talk a little bit about our issues that we're going to be talking about on Monday, and hopefully help those of you who may not be familiar with them kind of get a little bit more familiarity with these issues. And so please, again, like as we go through this, I do want it to be interactive. If you have questions, you're like, oh my gosh, I don't know what you're talking about. I need a little bit more detail. This is a great time to speak up. You can put the question in the chat. You can even message me the question just to me if you're like, oh, I don't want everyone to know that I'm asking that question. And you can also feel free to like raise your hand and unmute and ask a question and we can have a dialogue. And those of you who are experienced advocates, these issues are going to be familiar. Please feel free to speak up and share your suggestions for your fellow advocates as well. Okay, so we're going to jump right into it. There are 2 bills that we are going to talk about this year when we advocate in the state capitol. And we will cover some of the logistics of that at the end, but I kind of wanted to start off with the meat of the topic and the policies that we're going to be talking about. So, the first one, oops, I'm jumping ahead. My slides are jumping ahead on me. Sorry. So the first one was introduced by Assemblymember Zabur. Assemblymember Zabur is the chair of the California Legislative Rare Disease Caucus. So that is a group of legislators who are committed to policies that support people living with rare diseases. And he introduced a really interesting proposal this year, which would ban a practice that we call utilization management. So, utilization management are strategies that um, insurance companies use to delay and deny treatment. They're trying to lower their costs and they use these strategies to delay or deny the treatment. And so these are things that are sometimes called step therapy or fail first therapies. That's when they might say, hey, we don't want you to go on the drug or the treatment that your doctor prescribed. This other treatment is cheaper, and we're going to make you try that one first. And sometimes that happens even when a patient has previously tried that product and it may not have worked for them. There's also something called prior authorization, meaning you have to get the approval of the insurance company before you can start taking the treatment. In the case of a prescription, that usually means you have to get that approved. That's going to mean you have to get that approved before you can go pick it up at the pharmacy and start using it. And so these delays, sometimes can go on for months, months and months of a back and forth between the provider and the patient and the insurance company, and it can really delay treatment. In the case of rare disease treatments, so those are treatments that are FDA approved for a federally recognized rare disease. Um, Typically the treatments all eventually end up getting approved. And so the insurance companies are going to pay for them anyways, but the delays, these months and months of delays can be a reason that complications can occur. A lot of rare diseases are conditions that the patient progressively gets worse, and those that lost function, that lost muscle tone, or that lost neurological capacity, it doesn't necessarily come back when the medication when they go on the medication. It just stops it from continuing to get worse. And so any delay can cause complications and outcomes that are going to be worse for the patient, right? Couple of statistics that are talking points that I threw on here of interest to people. 1 in 10 Californians have a rare disease, and 1/3 of children born with a rare disease will die before the age of 5. So I think that those are things that really highlight the importance of making sure that there are no delays in treatment of patients with rare disease. And there are quite a few already joint authors of this legislation, I will point in. I think there's like 5 or 6, maybe actually more than that, 7 or 8, primarily members of the Rare Disease Caucus that have already signed on to the bill. And that includes both Republicans and Democrats who have signed on. Does anyone have any questions before we go on to the next topic about like, what is utilization management? What do we mean when we say rare disease? Anything about this bill? Feel free to add your questions in the chat or just go ahead and unmute and ask. Or if any of my, like, again, experienced advocates want to add something, please feel free.
This is important. I mean, bleeding disorders are rare diseases or medical conditions, and we do have treatments, but we also are partnering with other rare disease entities because we have stronger voice, when we speak up together. So this is affecting not just our community potentially, but our other partners with other chronic conditions or diseases.
Exactly. Thanks for that, Stephanie. Yeah, this would be beneficial for the bleeding disorders community, but also lots of other rare disease communities who, a lot of them are just getting therapies for the first time now. Meredith.
Hi, Lynn. The one-third of children born with rare disease.
Oh,
Sorry.
hey Meredith, we're getting an echo. I think it might be because I don't know if Paul and you are in the same place. Let's see if you can unmute now and try that again. Are you able to try again, Meredith?
Um,
Maybe, I don't know what's going on with the sound. Maybe throw your comment in the chat and I can read it out.
It's in the chat.
Oh, sorry. I had
That's
other
okay.
threads. I think that's a national statistic about children with rare diseases. Yeah, not necessarily a California specific one. Yeah, and I had a parent who spoke up and sent me a message as well that they said, they went through that process years and years ago where the insurance company was delaying them and it took months and months for her child to get treatment. So it really is important and again could be very beneficial not only to the bleeding disorders but community but other people in the rare disease community. So um, excellent. Well, let's go ahead and go on to the next issue. And if anyone has any other questions that come to your mind later on this, we can always loop back. So the next issue is going to be familiar to any of you who have participated in advocacy at the state and federal level previously. This will be, I believe, our third attempt at passing copay accumulator legislation in California. And so this has been introduced this year by Senator Weber Pearson. She was our author previously, but she was in the Assembly at the time. Now she is in the Senate, and she is also chair of the Senate Health Committee. So very exciting to have a bill that is authored by the chair of the committee that it's going to go to first. And also, the other thing that's very exciting about the bill this year is that our sponsor of the legislation is actually the insurance commissioner's office. So, Insurance Commissioner Ricardo Lara is sponsoring this legislation, and I think it will go a long way with the legislators that this is an insurance issue, right? How insurance is treating patient assistance. And then the insurance commissioner is coming and saying, I believe that this is a problem that patients, consumers need to be protected from this practice. And essentially, he is asking for the authority to enforce that issue and protect patients.
Hey,
Yeah,
hey,
sure.
Lynn, it's Cher. So one of the great things about this bill for everyone is not only will it's, the all copays count. So if it became law and you have copay assistance, then it will apply to your maximum out of pocket, as well as your deductible and all of those things. But one of the great things about the bill this year is the fact that the author is the chair of Senate Health and the sponsor of the bill is the Department of Insurance, the insurance commissioner. So even though this is our third attempt, I feel like it's our best shot we've ever had because we're in such a strong place. We did not have that position of strength before when it was patient advocacy groups that were the sponsor. Instead, now the sponsor is the insurance commissioner. And the author, although it's the same author, the author now has a much stronger position as Senate chair of the Health Committee. So very exciting news on SB 1199. Didn't want to interrupt you,
No,
Lynn.
no, thank you. Um, And that's great. And I also think what's really interesting is the fact is as well, I think that this could actually be somewhat beneficial to patients that are on insurance plans under ERISA because the insurance commissioner's office has interpreted that the current rules under ERISA actually state that those plans should not have accumulators in them, but there is not enforcement that is taking place on that. And part of why the insurance commissioner wants this legislation is so that there is an enforcement mechanism. So they could potentially attempt, I can't guarantee it'd be successful, but attempt to enforce both on state plans as well as on ERISA plans, based on the current landscape as it stands right now. So, to kind of take a step back for those that maybe are not familiar at all with this issue, because I kind of jumped in like we all remember the previous bills and not everyone will. Um, how many of you are familiar with copay assistance? Maybe you can like put a little thumbs up on the, in the Zoom if you're familiar with what copay assistance is. So many people in our community and many people across sort of rare disease communities use copay assistance in order to be able to help afford their medications, right? You have a large copay or on your medication, and you may not be able to afford that, right? And with bleeding disorders medications, sometimes that copay could be thousands of dollars. But these patient assistance programs exist in order to be able to help cover that cost for a patient. And the idea when they were created is that they would serve as a bridge to make those payments. And then once a patient reaches their maximum out of pocket, their maximum cost sharing requirements, then then the insurance fully kicks in and they're 100% covered, right? So they won't have a gap in being able to pay for and take their medications. But then insurance companies decided that in some cases they were no longer going to count that assistance towards the patient's cost sharing requirements. And this bill is written very clearly, very simply, and it just says essentially any payment made on behalf of a patient, even if it comes from a manufacturer payment assistance program, must count towards that cost sharing requirement. Okay, so sometimes we use the example of a college scholarship, right? So some of you who have been to college may be familiar with this, right? You get a scholarship in order to help pay for your tuition. Well, imagine if you got a $5,000 scholarship and it went to the university and they received the check and they cashed it, they deposited the payment, but then you got a bill saying you still owed them $5,000. And you went back to them and you said, hey, remember that scholarship you received? That was covering that $5,000 that I owed on my tuition. And they said, yeah, thanks for that extra money. That will really help us out. But we want you to pay that out of your own pocket. We think that you need to pay for that yourself. And so because of that, they are not applying it to your tuition, right? They're taking the money, but they're not applying it. That's essentially what the insurance companies are doing with this money for your prescription. And we all know that unlike emergency care, if you go to the emergency room and you're, really sick, they have to see you regardless of whether or not you can pay them right there in that minute. But if you go to the pharmacy and you can't pay for your prescription, you are not going home with that medicine. They're not going to say, like, oh, we'll bill you later for that. No problem. Just take it with you and we'll work it out. That's not what happens. So if you can't pay for your copay, you're not going to receive that medication. And then you're not going to be able to, stay healthy, with the medications that you're on. Questions on this issue. It can be a little bit complicated, so we're trying to kind of boil it down for everyone, and we went through that pretty quickly. So would love to hear from other folks if you have other ways that you have practiced sharing this information that you want to share, or questions about how this works? And we'll just pause here for a minute. If any questions pop up. Thanks, Pedro. All right, so I'm not hearing any questions. If they come to you in a minute, please feel free to go ahead and, raise your hand or put them in the chat, okay? And I will say we will have a little bit more time to go over this on Monday for those of you that are participating. But we would love to, happy to answer your questions now if they pop up. And by the way, a representative of the insurance commissioner will be there on Monday to we're going to honor him for his support of the community through this effort. So we're looking forward to having them there. Oh, that's a really good point, Stephanie. Stephanie threw something else in the chat, and that is just to say that sometimes they will say, oh, these are coupons, right? Which is really a different thing that manufacturers will sometimes use to help incentivize patients to, utilize certain products. What we are talking about here, these are not coupons. And under California law, you can't use any assistance on generic drugs anyways. And so this really is not a case of patients being steered towards more expensive drugs, the way that the California policy would be written. So those are just a couple of counter arguments that sometimes we get. But you don't have to be that complicated with it if you're not super familiar with the issue. So, all right, moving on. The next item is like a standing item that we always advocate for, and that is for support of Medi-Cal, CCS, and GHPP. And Cher, can I put you on the spot for a minute, and maybe you can just give a little quick, like, I don't know if there really is good news when it comes to the budget, but I was going to say like good news, bad news scenario about kind of the budget situation, just like a real quick level set of where we're at and why we're concerned
Yeah.
about this.
So, because of the passage of HR 1 at the federal level, that's the one big, beautiful bill, right? There were many changes to the Medicaid program for all the states. And those changes are going to result in about a $1 billion loss every year for the state of California. That's a lot of money to be missing, right? It's kind of hard to fill the gaps from other programs on $1 billion, which makes you concerned that if we're going to have a $1 billion loss in federal funds to the Medi-Cal program, makes you concerned that the state will look at the Medi-Cal program and say, okay, how can I save costs to try and balance this out? And that's why we are concerned about protecting GHPP and CCS. During the Schwarzenegger administration, one of the things that Schwarzenegger administration wanted to put on the chopping block during the days of very bad deficits was GHPP. They wanted to eliminate it. And HCC at the time and lots of other patient advocacy groups got together and they rallied to save GHPP, and that kept GHPP from being eliminated. But we were very close back then because of budget deficits. So because we know that the costs to the state are going to be so severe because of HR 1, we want to make sure that we educate legislators now about the importance of the GHPP program. So it's not on anyone's chopping block at all. We want to hit this now and educate people now. So now I give you the bad news, but here's the good news. The good news is that although the state of California is projected to have a shortfall, the tax revenues that have been coming in every month are actually above forecast. So we're doing our economy, seems odd to me because So many people are hurting right now, but because of the California economy's connection to the stock market and because the AI stocks are booming right now, we're actually bringing in a lot of tax revenue, and that's going to save us this year. I don't anticipate big cuts to the Medi-Cal program this year, but next year is what everyone is saying. Oh boy, we're in for some hurt next year, right? So that's why we need to educate legislators now about the importance of the Medi-Cal program and GHPP and CCS for our population, so that next year, when they're looking at what to cut from the Medi-Cal program, it's nothing that impacts our community. I'll kick it back over to Lynn.
Thanks, Jer. Yes, so that's exactly right. There are, not immediate, not immediately announced threats, I would say, to GHPP and CCS. The governor's proposed budget in January was pretty short on details when it came to healthcare. And so there were no, noticed cuts there, but we certainly know that because of the impact of HR1, there are going to be changes to Medi-Cal, and we are concerned. If not this year, then potentially next year and the following year as it relates to CCS and GHPP. So I do not want anyone to panic or think that their coverage through any of these things is going away tomorrow, but this is a really good opportunity to remind legislators how important these programs are, and that specifically they need to really be thinking about the fact that patients with rare chronic conditions like hemophilia and VWD and the other rare blood disorders that we have in our community, they need to maintain access. I mean, I think it's one of those things that you see lots of debate about healthcare and how it should be structured, but usually everyone kind of understands that people who are struggling with specific illnesses need to be able to maintain their coverage, right? And so I think part of the argument that we need to make is that these populations really need to be protected. And the other thing that we can definitely make as an argument in our community is the better our healthcare is, the more we're going to be able to engage and be, sort of contributing members of society, right? Like when we stay healthy, we can go to school and we can work and we can volunteer our time and we can live really relatively normal and active lives. And it's when we lose access to healthcare and we no longer that's when we're going to end up in the ER and having all kinds of complications. And ultimately, it's obviously not good for the patient, but it's, not good overall for our state either. Meredith pointed out the County Health Executives Association in California has also made funding for CCS as one of its top legislative priorities this year. I know that there are other groups, Family Voices, others that are going to be lobbying in the coming days, and I'm sure that this is a priority for all of them as well. Do you have questions for for us on this issue? Hey, everyone understands the California state budget. That's awesome. Not one of the easiest things to understand, but I think our message is clear, right? And one other thing I will add before we kind of move on from this point is that you can share this story more than one way, right? So some people will come to legislative day and they'll be like, "Well, I've never needed to use Medi-Cal or GHPP or CCS before. So how do I talk about this issue?" And I think you can frame it from, "Hey, I've been one of the lucky ones that has had access to good insurance outside of these programs. And this is how that has impacted my life in positive ways. And so, because of that, I want to make sure that everyone in my community has access to that kind of excellent care, right? So even versus, if you have benefited from those programs, and you can directly and specifically share your story about how you've benefited from those programs and how those have helped you to be able to stay healthy and get the coverage that you need. Okay, so even if you haven't had direct personal experience, there's a way to talk about that. Okay, so next part. Now we're going to get a little bit more into some of the kind of logistics and what it's going to look like when you have a meeting. Um, Yeah, this is a good point too. I'll just add this in case you're not looking at the chat. Without Medi-Cal, CCS, and GHPP, it's also very possible that um, like hospital ERs could become overcrowded, right? Because people will end up going to the ER only because that's the only option that they'll have for healthcare. And that's definitely a concern for everyone, right? Anybody who might need the ER wants to know that it's going to be available when they need it and that it's not going to be completely overcrowded. Okay, so moving to the logistics and the elements of your meeting. You're always going to want to start out with introductions. Um, and so you start out with introductions, and you're going to want to make sure that whoever is the constituent in the meeting, and we will help make sure you know that information, your group leader will know that information, is going to want to identify themselves and make sure they're really clear with the staff or the legislator and say like, hey, I live in your district. Thanks for meeting with all of us today, so that they know that there is at least one or multiple constituents that are coming to talk to them. And introductions is a great time to do that. We also recommend that kind of at the beginning of your meeting, feel free to ask again the staff person or the legislator that you're meeting with, hey, like, are you familiar with bleeding disorders? Like, do you know what a bleeding disorder is? Um, we've been at this for quite a while in the state capitol, meeting with legislators every year. And because of that, there are some staff that meet with us year after year, and they are very familiar with bleeding disorders. So you may not have to give them the basics, but you might also be meeting with someone new. Maybe they're new to their role, maybe they're new to the state capitol, or maybe they're just new to health, right? Sometimes people switch policy areas. Even if they've been in the Capitol for a while, maybe their bosses before weren't bosses that sat on health committee. So you can always start by asking the question, and that will help kind of level set the conversation. And you can talk to them a little bit about kind of what is a bleeding disorder. I always feel like the best way to do that is weaving it into the context of your story, right? And so telling them a little bit about yourself and your experience allows you to weave in kind of like what it's like to live with a bleeding disorder. And it also personalizes it, right? It makes it more about a real person that they're sitting there talking to, as opposed to just this idea of, somebody who might have this condition. And then you're going to go into the things that we just talked about. Those are your asks, right? Those are the things that we're there to ask them for, their help to accomplish these policy changes. And then you're always going to give an opportunity for them to ask you questions, right? They may have some follow-up questions for you. And I know there's another slide that touches on this, but I always want to remind everyone, do not feel intimidated by the questions. They're not trying to trip you up or, cause you an issue by asking you a question. for the most part, people who work in the legislature are genuinely curious people who like to learn. And so if they're asking you questions, that's usually a really good sign. They want to know more. They want to make sure they're understanding the issue. And they see you as somebody living with this bleeding disorder as an expert who can share with them what that is like. So don't be intimidated by the questions. But if you get a question, especially maybe more in the weeds on the policy that you cannot answer, do not feel pressure to give them an answer on the spot. It is so much better to just tell them, hey, that's a really good question. I'm not sure. Let me write that down and we will get back to you. Because you never want to give bad information. That's where we really lose credibility. So we never want to tell them something that's wrong or guess. It's much better to get back to them later. Great point, Kim. She said regarding our asks, they're expecting you to make these asks. So never feel awkward about the asking. They fully expect that this meeting is going to end with us making an ask. And so you should feel very comfortable and confident doing that. Cher, did you want to add anything on that?
Oh no, I think, what this whole advocacy day has such a great reputation at the Capitol that they're usually quite excited to meet you all. So they look forward to this on their calendar every year. So I would just go in and have fun with it because they're looking forward to meeting you.
Especially you teens, honestly, legislative staff and legislators love when teens and young people come to the Capitol. And that's part of, I think, what's built the reputation of this lobby day over the years. And so they are all looking forward to interacting with you. Um, and so, just a little bit, we talked about this a little bit when we go over, what is a bleeding disorder? Ask if they're familiar with bleeding disorders. Try to use simple terms. We always like to remind everyone to avoid jargon and acronyms, right? We all kind of talk in this language. We talk about bleeds and factor and HTCs, and those are things that we might have to explain to somebody not familiar with a bleeding disorder, right? They don't know what an HTC is. They don't even know really what we mean when we say we're having a bleed, because most people think of external bleeding, not internal bleeding. And they don't know about how we bleed in joints and muscles and all of that. And so those are all things that you can kind of try to personalize again as you tell your story. It's a really effective way to kind of get the point across is by giving examples from your own experience. Then again, just recapping, we're asking for support for AB 1887, for SB 1199, and then supporting budget funding for Medi-Cal, CCS, and GHPP. And you're gonna have like a leave behind that has all of that information on it that you're gonna be able to give to the legislative staff that you're meeting with. When it comes to the question times, please give them an opportunity to give you feedback or ask questions. One thing that I want to note, just so that people are not disappointed, we will, in many cases, be meeting with staff. This is not a bad thing because, as somebody pointed out at another legislative day that I was at, oftentimes when the member is running to go vote, they're going to look at that staff person and be like, was I a yes on this or a no on this? Right? So like you're giving information to the person that's going to be advising them later. And staff actually in an era of term limits, in the state legislature, staff actually sometimes stay there longer than legislators. And so, as you build that relationship with staff, you may find them working for another member a different year that you go. And we've built that relationship. You've built some trust with them, and they can be some of our greatest sort of advocates and allies right there in the building. So, uh, there's no reason not to be excited about. I know it's always exciting um, when you meet with a legislator, but don't discount the staff. Yeah, and Kim mentioned sometimes staff run for office later and they might become a legislator. You never know. Um, that has definitely happened in the Capitol. I can think of a couple of them right now that were staff once upon a time. And then the other thing is, though, if you are meeting with staff, don't be disappointed if you do not get a specific commitment out of them about the position on a bill. Staff will almost never give you a commitment of a yes vote or a no vote on a piece of legislation without talking to their boss. So unless it's an issue that they've already discussed and their boss already has a public position on it, you will probably get a, sort of thank you very much. We'll talk to the boss about this. Sometimes they might be like, this seems like something that they would typically support. Like you might get that, but you will almost never get a commitment. Typically, if we do get an instantaneous commitment at legislative day, it's because you're actually meeting with the member. And then, of course, they can speak for themselves and say, like, yeah, I'll support that, which is always exciting when it happens quickly. But just because you don't get the commitment in that moment doesn't mean that it's not going to pay off when it comes time for the bill to be heard later. Okay. So a few things for preparing. You're going to review the materials in advance, and you're going to want to practice your story. Just a couple reminders. These are like logistical things. You want to wear business attire. Jeans, hoodies, not really appropriate for legislative day. As part of Bleeding Disorders Awareness Month, we encourage people to wear a red tie or scarf. If you have one, you can bring those from home. If you don't, we will have both ties and scarves available in some limited quantities. You will be walking a bit. So even though you're wearing dress clothes, keep in mind that you will have to walk a bit and try to wear some dressier shoes that are still comfortable. That you can walk a bit and stand a bit in, and that your feet hopefully will not be killing you. Like, do not break in new shoes on legislative day. Not recommended. Um, I also like to remind people ahead of time, you will be going through security. So, our students who are flying, et cetera, like they will already have had to, remember to like not bring a pocket knife and things like that. But for people who are driving to legislative day, make sure that those things are not in your bags. Um, there will be staff and volunteers in our meeting space. So you can leave things there, but you do not want to take those things with you to security. It's pretty much like the airport, but you do not have to remove your shoes. And this is, I think, important. You can bring water or a beverage in with you. So if you have a bottle of water and you want to carry that with you, to stay hydrated, like that's totally fine, and you won't have to dump it out in order to go into the meeting space. And then we will encourage you to get over to that meeting space a little bit early. Sometimes the lines at security can get a little bit backed up, and so we'll try to time that appropriately. Great comment, and another great comment in the chat, which is a really good reminder, is that nobody's going to be doing their meetings solo. All of these are going to be groups. You're usually going to have maybe like 4 to 6 people, and the meetings are always a group effort. So if you feel like, wow, I didn't speak up, but I'm really kind of confused about that copay accumulator, copay assistance issue. You don't have to be the expert on that issue. Someone else from your group might be able to help you. Most of the time, if you get stuck, someone else in your group is going to be able to jump in and help you, which is absolutely awesome. Yeah, and this is also good. The offices are not very big. They don't have very many meeting spaces in their offices. So don't be upset or offended if they're like, hey, can we go find a space in the hall? One of the nice things about the new swing space is that there are actually like a lot more meeting spaces. Like some of them are in sort of like the public area. But sometimes staff will just take you out there and find places and you can sit and talk. When you go to DC and they're like, you need to take the meeting in the hallway, you literally stand in the hallway because there's like nowhere to go sit in any of those buildings, pretty much. And so, at least in our news space, there's a little bit of space for that. Okay. When you actually come to the meeting, you're going to make sure your whole group has arrived and you're going to check in at the front desk. Again, like I said, you're going to most likely meet with staff, which is totally fine. And you're going to start with introductions. Just a little reminder about our protocols. Everyone signs an agreement about this, but we want to be very respectful. We want to use persuasion. There's no need for confrontation, and we're going to keep our meetings focused on the issues that BDCC has laid out for you. If you have any other items that you want to lobby your legislator on, you are more than welcome to, follow up with them and schedule a separate meeting on your own time to do that. But we want to keep this focused on bleeding disorders. And then it's always great, and most offices have no problem with this. But there have been some members that have changed on this a little bit. I think it's kind of a sad reflection of our current times that folks are a little bit more shy about taking and posting photos. But so always ask permission first if you're going to take pictures. And then try to see if you can get a picture with the legislator or with the staff if they're willing. And then sometimes the staff doesn't want to be in the photo, but they'll take a picture with you standing next to like the member sign or something. And then we can post that on social media after the meeting and give them a shout out, maybe remind them about the issues. Um, We've really touched on this, but I just want to again reiterate the best thing you can do is tell your story. If you run out of time and don't have a lot of time to go over the issues, that's okay. Tell your story, and they're going to tie that story with the issues that you're going to be able to leave with them on the piece of paper. They want to hear from you. They want to hear how this affects your life, and that's what's most compelling. So really focus on that and and then you can just kind of quickly tie it to our asks at the end. Don't be afraid to like include the asks. I mean, we don't want to leave those out, but you want to really focus on your stories. Okay. In terms of follow-up, we would encourage you to get a business card of the person that you met with, so that you can follow up. We will have a list. We should know, and your schedule should tell you who you're meeting with, but occasionally that will change. Sometimes things happen in legislators' offices, and even like a staff member might get like called into another meeting or have to go to a committee hearing or something, and they might just tag team it in the office and someone else will take the meeting. That happened to me when I was in DC a couple of weeks ago. Like the person I was supposed to meet with wasn't available, and so someone else on the staff met with us. So particularly in that case, if you can grab the card, if it's not the person you thought it was going to be, that will help you and us be able to follow up and say thank you. As we've talked about, you can engage on social media. We've given you some of the hashtags that you might be able to use to kind of coalesce the information. And then we're going to ask the group leaders in particular to report out to us how your meetings went. Cher and I are available to follow up with people who might have had questions or might have been seem like they're leaning one way or another on a bill. And so we need that information. Sometimes you also find out things like this person has a nephew with a bleeding disorder, or their high school friend has a bleeding disorder. And that can be really interesting and useful information to us to be aware of because then it helps us to know where some of our allies might be in the Capitol. So if you get anyone sharing information like that, it's really helpful if you pass that along. We may or may not already have a relationship with that particular staffer. And then we always encourage you to send a thank you. You can do it via email or you can do it with a handwritten note. And we have samples in the toolkit of how you can do that. But it's always great to send a follow-up and say thank you. Not as many people do that anymore, and I always think that it has an impact when you follow up with them. And it also just brings the issue like back up to their mind, and they're like, "Oh yeah, I was going to ask the boss about that." Sometimes might remind them. Okay, I promise this to folks who maybe are not participating for whatever reason. There are ways that you can participate even if you're not coming to Sacramento on Monday, and that is via you can send letters or emails of support on these issues to your legislators. So you can utilize the toolkits and kind of put some of that information together and send your own email to your representatives. If you want to do that and you're like, I have no idea how to find out that information, I didn't take the time to put all of that in the slides tonight, but happy to help you navigate that. So just shoot us an email and we'll help you do that. You can also participate on social media. If you use social media, you can shout out your legislator on social media channels and share the same information. And then I want to encourage everyone. We're looking at doing a virtual Rare Disease Access Coalition lobby day in May sometime. And so for those that maybe just couldn't travel to Sacramento, or maybe you just are going to come to Sacramento on Monday and then you just can't get enough of this advocacy, feel free to sign up and join us virtually in May, where you'll be able to do it right from your own home. All right, just a last couple of social media tips and tricks. We really encourage you to use photos. That always grabs more attention. A photo you took at the meeting, a personal photo, or we will have usually have graphics available that you can kind of put into your post. And then I think a lot of this everyone kind of knows now, like, find your legislator on the platforms they're active on. The biggest thing is be respectful, right? Always assume that your posts are going to be public and can be seen, even if you think your settings are private. Oftentimes people can see more than you think. So always assume your posts are public and they are going to reflect on you and BDCC and the bleeding disorders community. So we always want to go about this communication in a respectful and appropriate kind of way. All right. Any last questions on the logistics or how the meetings are going to go, when you're going to find out about your groups, any of that? I've bored you all into silence at this point, apparently. Or everyone's just tired like me. All right. Well, thank you all for hanging in tonight and learning about this. I always like to remind everyone, you are your best advocate. No one else can tell your story, right? Because it's your story and your story alone. You are the expert on your experience. And so we thank you for taking the time to participate and to tell your story. And I did get a question in the chat to our future leaders specifically. Um, we've talked about how on Monday, business clothing is appropriate, business casual, jeans, more comfortable walking shoes, all of that is fine for our future leaders for the day, the 2 days prior and the one day after legislative day. So you only have to be in your Sunday best, so to speak, on Monday. Wrong day, but you get the idea. You can be a little bit more casual on Saturday, Sunday, and Tuesday. So good question, and I think that will be an information that's going to come out to you as well. All right. Real quick, we have some all of our kind of upcoming dates. I'll also just, throw a shout out for Fall Advocacy Days. In the fall, we will do advocacy again in district. I hope that you will keep that in mind and join us for district office meetings in the fall. And as always, we want to thank our sponsors that make our webinar series possible. And I will just leave it on here in case anyone needs to reach out to us. So, future leaders, we will see you on Saturday. The rest of our advocates, we will see you bright and early on Monday morning. And we're looking forward to a great advocacy day. Thanks, everyone. Feel free to email me if you have any other questions that we didn't answer or that you just didn't get a chance to ask tonight.